Today we are going to discuss about suprarenal gland. The suprarenal gland, which is also called the adrenal gland. And if you like the video, please subscribe, like and share. Introduction. Its position is it is located on the upper pole of each kidney on the right and left side. They are covered by peritoneum on the posterior abdominal wall and they are embedded into the perirenal fat which cover the kidney also. The left one is larger and higher than the right one. And here in this diagram you can see the right kidney and left kidney. In the upper pole of these two kidneys there lodges the adrenal gland. Okay, and here the left kidney or the left adrenal gland, it is crescent in shape. Also we can say that it is semi-lunar in shape. The left adrenal gland, which is semi-lunar in shape, and it is located on the upper pole of the left kidney behind the stomach. Anterior to it is related to the stomach, the tail of the pancreas and the lesser sac. And posteriorly it is related to the left crus of the diaphragm. Here in this picture you can see the left adrenal gland. It is semi-lunar in shape and it is related to the pancreas. Anteriorly it is related to the lesser sac and stomach and posteriorly to the left crus of the diaphragm. Next, the right adrenal gland. It is triangular in shape and it is located on the upper pole of the right kidney and behind the inferior vena cava. It is situated, you can see in this diagram, there is the upper suprarenal gland, the right suprarenal gland situated on the upper pole and it is situated behind the inferior vena cava. And here it is related anteriorly to the inferior vena cava and the right lobe of the liver. It is related to the inferior vena cava and to the right lobe of the liver, and you can see there is the hepatic flexure, which means there locates the right lobe of the liver. And the posteriorly it is related to the right crust of the diaphragm, to the inferior vena cava and the right lobe of the liver, and posteriorly it is related to the right crus of diaphragm. So in this diagram you can see there is inferior vena cava, the hepatic flexure, which means the area of the liver where it is located, and the intestine form a flexure at region is called the hepatic flexure. So related to the inferior vena cava they are present the liver. Already we have discussed in the liver there is a groove for inferior vena cava. So to the right side of this inferior vena cava there is the right lobe of liver. The blood supply of suprarenal gland. Each suprarenal gland, which is supplied by three arteries: superior, middle and inferior suprarenal arteries. The superior suprarenal artery is a branch of inferior phrenic artery and which in turn is a branch of aorta. The middle suprarenal artery is a branch directly from the aorta and inferior suprarenal artery is a branch from renal artery. And you can see in this picture, here is the superior suprarenal artery. There is many branches, which is a branch of inferior phrenic artery, which in turn a branch of aorta, and middle suprarenal artery is a direct branch from aorta, and the inferior suprarenal artery is a branch of renal artery. And the venous drainage. The vein draining are suprarenal vein on the right side at the inferior vena cava and on the left side at the left renal vein, and you can see this in the picture. There is superior suprarenal, the right and left suprarenal vein, you can see it directly drains into the inferior vena cava, isn't it? And you can see the left suprarenal vein which drains into the left renal vein. And next is the structure of adrenal gland. Here in this structure you can see it is the cross section of the suprarenal gland. It is covered by capsule and It consists of outer layer of cortex and inner layer of medulla. And here the adrenal cortex, which consists of three layers, which is arranged from outside to inner side by zona glomerulosa, zona fasciculata and zona reticularis. Here in this picture, the first one where is the suprarenal gland, then the next diagram representing the A, figure A, which show the histological cell structure, and the B, which show the microscopic view. And here we can see it is covered by the capsule, and it is outermost part which is called the cortex, and the inner part is the medulla. The outermost part there consists of three layers: zona glomerulosa, which is near to the capsule layer, and zona fasciculata is the middle layer, and zona reticularis is the innermost layer of the cortex. So there are three layers for the cortex: zona glomerulosa, zona fasciculata, zona reticularis, and the inner layer which is called the medulla, adrenal medulla, and it consists of lot of blood vessels. And now we are going, and next is the clinical problems. Here various clinical condition occurs due to the lesion of adrenal cortex or medulla, and it affects the secretion of adrenal hormone. The hypersecretion of the hormone of the adrenal cortex results in Cushing's syndrome, which is characterized by the redistribution of fat in the spindle limbs, and it seen as swollen face, and occurs diabetes mellitus and slowing of wound healing process. The hyposecretion causes the Addison disease, which is characterized by the weight loss, muscular weakness, and hypoglycemia, and the low blood pressure and dehydration. Dehydration means loss of water from the body. The hyposecretion of gonadocorticoids cause condition called adrenogenital syndrome. So these all about the adrenal gland. You have to study the position, location, where it is located, and the right and left adrenal gland, its relation, anterior and posterior relation, blood supply, it include arterial supply, venous drainage, and the clinical problems. And also you have to study the structure and what are the layers of medulla and cortex. Thank you very much.